2020, the world was hit with a global pandemic, COVID-19, that killed approximately 4 million people from 2019 to 2022. Almost exactly 100 years earlier, in 1919, the flu pandemic killed more than 21 million people. These pandemics were very different, but also had similarities. 1918 was a very different time. While the 1918 flu pandemic led to major advancements in future flu prevention, treatments, and revolutionized public health, not all the lessons learned would be heeded 100 years later with COVID-19. Now for the basics of the flu and pandemics. The flu is a common respiratory illness brought on by influenza viruses that can sometimes spread to the lungs, as well as the nose and the throat. The flu has been around for at least 1,500 years according to records. The first person to describe the spread of an influenza-like illness was from northern Greece. The flu is a very common illness in our world today. A pandemic is a widespread occurrence of an infectious disease over a whole country or the world at a particular time. There has been 249 pandemics throughout the years. There's been a lot of pandemic outbreaks in our world, and there's still going to be a lot. The Spanish flu infected around 500 million people globally, and it killed around 21 million people. In 1918, the first influenza appeared on the April 5th weekly health report. And then in September 1918, a second wave of flu emerged at Camp Devens, United States Army training camp just outside of Boston. Then between September and November, a second wave of flu peaked in the U.S. Then in 1919, a third wave happened in winter and spring, killing more and more people. But then fast forwarding to April 1920, individuals who were infected either developed immunity or died. Philadelphia and St. Louis were both hit with the flu outbreak during 1918 to 1919, but both of these places reacted to the flu pandemically differently. In September 1918, Philadelphia hospitals were at capacity, and around the same time, St. Louis were closing their schools, libraries, courthouses, churches, and playgrounds. St. Louis had a death rate that was only slightly higher than Philadelphia. In St. Louis, the virus-related mortality was estimated to be 358 per 100,000 persons, compared to 748 per 100,000 in Philadelphia. None of the cities that continued their efforts had a second rebound of elevated fatality rates This shows taking action really helped. Here, both of these cities decided to go into more strict lockdown using information from what was going on around them. COVID-19 virus is the first pandemic of the size for which the exact infection and the location of its origin had been known since the beginning. The start of COVID-19 was also similarly abrupt. Hospitals in Wuhan, China reported a number of cases of pneumonia with no known cause on December 31st, 2019. Right when COVID-19 started, there were 11,327,790 cases confirmed and about 532,340 deaths. After living through COVID-19, it is clear that we didn't learn a lot from the flu pandemic. One thing that we need to work on is how we communicate. For example, at the beginning of COVID-19, everyone was told to stock up on supplies that led to running out of stock at the beginning of the pandemic. Also, with COVID-19, everyone treated like it was only bad for elderly people, but there's still a risk for younger people. First in line for vaccines were healthcare professionals and those who are 80 years old or older. There was at least a 100-year gap between the Spanish flu and COVID-19, but we should have been more prepared. The Spanish flu was a very different time, but there are still lessons that can be drawn from what they did. A quote by Javelin Duffin, a medical historian at Queen's University, says, "We have this habit. It's a human habit, that once it's over, you are so glad you didn't prepare properly." When the Spanish flu ended, most people were so relieved that they weren't focusing on getting ready if there were to be another pandemic. While the 1918 flu pandemic created major advancements in flu prevention and treatments and revolutionized public health, not all the lessons learned would be heeded 100 years later with COVID-19. According to the Associated Press, on January 30th, President Joe Biden has informed Congress that he will end the twin national emergencies for addressing COVID-19 as of May 11th, as most of the world has returned to closer normalcy nearly 3 years after were first declared. But now that COVID-19 is coming to an end, how can we prepare more for the next pandemic?